Welcome to the IngiaTek Health Provider Onboarding Clinical Monitoring Training. In this training, we're going to cover remote patient monitoring and go through an overview of that program. Alerts and notifications that you'll receive through the IngiaTek Provider Dashboard, documentation, and monthly data reviews. Remote patient monitoring, also known as RPM, consists of various devices in a patient's home that provide real-time results to the patient using the IngiaTek Health app and to the provider using the IngiaTek Health Provider Dashboard. These devices currently are a glucose monitor, a blood pressure cuff, a scale, and a pulse ox. So we talk about a clinical monitor. You may ask, who can be a clinical monitor? So to be reimbursed by Medicare, Medicaid, or private insurance, a clinical monitor must be a clinician working within a medical practice or a licensed healthcare provider. A clinical monitor could be a nurse practitioner, a physician, or someone else that has a clinical degree. Those individuals must work under an organization that's licensed to provide that kind of service. So in some organizations, it may be a doctor's office doing this work. Other organizations may be an in-home provider that has a clinical monitor or a nurse that works with them that can monitor the health of those individuals within that program. So it's important to make sure that you know if you have the correct licensing and or staff to do clinical monitoring. The IngiaTek Health Patient App. All individuals on the IngiaTek platform will have access to the IngiaTek app. The app can be easily downloaded right from the Apple App Store or the Google Play Store. The app provides patients with their results so that they can share that information with their family or whomever they choose, and they can see all of their results in real time. What is the IngiaTek Health Provider Dashboard? It is a cloud-based dashboard that you can go to receive information and notification about your clients that are in the IngiaTek system. You'll be able to review your clients' results, look at trends. You'll also be able to manage the users within your practice. When you log in, you will have your own user login that will provide you only access to the individuals under your system. In addition, under the IngiaTek Provider Dashboard, you will be able to contact us for customer service, and you can always reach out to us to help you with adding users or deleting users within your organization. It is suggested that you also give access to your billing team to the IngiaTek dashboard so that they'll be able to see any documentation or information that you have related to your individuals that you serve. The IngiaTek Provider Dashboard is simply linked on our IngiaTek Health website, or you can go to www.dashboard.ingiatekhealth.com. You'll get all of that great information and those links once you finish your training. Alerts and notifications. In the IngiaTek Health Dashboard, you will be provided notifications once you've logged on. Those notifications will let you know if anyone within your organization that's using the IngiaTek platform has any results that are outside of the standard parameters. You'll look at those results, and once you've looked at them, you also would want to clear them so other people within your organization that may also be users will know that those alerts have been addressed. As we all know, documentation is extremely important. If it isn't documented, it didn't happen. That goes with RPM. To ensure proper documentation for reimbursement, patient notes should include the following information. You want to make sure that you document what the alert was that you received or the notification that you received in the IngiaTek Health platform. You also want to document who you spoke with. Did you talk directly to the patient? Did you talk to their caregiver or another physician? Whomever it is, you want to make sure that you have that information documented. You also want to document the time, date, and duration of the call. Recommendations that were provided to the individual should also be documented. Any follow up that's needed should be documented. You want to make sure that you put all of that information in writing because, as we've talked about in the billing training, you're able to bill for 20 minutes of time that you have spent working with the individual, reviewing their documentation, talking to the individual, making those recommendations, calling their physician, whatever it is that you're doing related to the data collected from the IngiaTek provider dashboard. It's all billable. And you want to make sure that you have the correct documentation to align with that billing. So, in addition to documenting when you receive an alert or a notification, you also want to make sure that you're doing a monthly data review. So, for those individuals that may not have been outside of parameters, but you're reviewing their information, you're talking to them maybe to tell them that they're doing really great with their blood pressure or that their glucose levels have been in really great range. You still want to document that information and you want to document that you are going through and reviewing that information. So, in that documentation, you should have what patient data was reviewed. You want to discuss that you were assessing for trends in those results. And you also, as I said earlier, want to talk about how you've informed patients, caregivers, or other members of the clinical team of any trends or recommendations that you may have related to that individual. So, your documentation includes things not just about what's wrong, but it also talks about what's right. Just make sure you document all of it and you still get those times and dates and durations so that you can add up to that 20 minutes within 30 days. Thank you so much for participating in our clinical monitoring training. Hopefully, now you have a pretty good understanding of exactly what you need to do as a clinical monitor. But if you have questions, the IngiaTek Health team is here to help. All you have to do is you can email us at info@ingiatechealth.com or give us a call, 410-878-6001. Thank you so much and have a great day.